Hello brain nerds, my name is Jason. Welcome to the Big Brain Blasters. So in this video we're going to talk about the arterial supply of the upper limb, and we are also going to talk about the clinical correlations. And as usual, at the end of this video I've put some practice questions that I would like you to attempt and see whether you've understood. With that being said, let's jump into it. Okay, so with me this is simply a diagrammatic representation of which I'm going to give you an overview about the blood supply to the upper limb. So there are some minor exceptions about the blood supply to the upper limb. In short, some minor differences actually. So these minor differences are simply where the subclavian artery is arising from. Now, take note that blood supply to the upper limb is via 5 main branches, and these branches are the subclavian artery, the axillary artery, the brachial artery, the radial artery, and the ulnar artery, which goes by the mnemonic SABRU, or some American boys ran up. You can use either of the two mnemonics. So let's say you have your heart right here, and from your heart you have the left ventricle, and from the left ventricle we know that the ascending aorta, okay, will arise from the left ventricle, which will form the aortic arch, and the descending aorta. So from the aortic arch you have 3 main branches that arise from there, which is the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. And the brachiocephalic trunk will give rise to the right subclavian artery and the right common carotid artery actually, and the right subclavian artery. Okay, so this is what I wanted you to know about, that on the right side the subclavian artery is arising from the brachiocephalic trunk, then on the left side the subclavian artery is arising directly from the what? From the aortic arch. Okay, so these are the differences. Then after the subclavian artery arises from either side, you know that it will terminate and form the axillary artery. Then the axillary artery will terminate and form the brachial artery. Then the brachial artery will run like that and then come at this point and bifurcates or divides into two. It will divide into the radial artery on the lateral side. So on the lateral part this is the radial artery, and on the medial part this is the ulnar artery. And the radial artery will form the deep palmar arch in the hand, and the ulnar artery will form the superficial palmar arch. Okay, then same applies on the left side here. So this is what I wanted you to know about the differences where the subclavian artery is arising from. On the right side we said that it is arising from the what? From the brachiocephalic trunk, right? From the brachiocephalic trunk. Then on the left side we said that it is arising directly from the aortic arch. Okay, so this is a more realistic diagram from the previous one that I drew. So as we know that we have our aortic arch, and from this aortic arch we have 3 main branches arising from there. You have the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. So on the left side, the subclavian artery arises directly from the aortic arch, while on the right side the subclavian artery arises from the brachiocephalic trunk. So this brachiocephalic trunk arises and then divides or bifurcates into the subclavian artery, which is the right subclavian artery, and the right common carotid artery, and then the course continues as we have already said. Okay, so now let's talk about the subclavian artery. So this diagram I'm showing is that of the right upper limb. So the subclavian artery on the right side, it arises from the brachiocephalic trunk. So as you can see there, this is the subclavian artery, and this is the right common carotid artery, and this is the brachiocephalic trunk, like that. Okay, so the brachiocephalic trunk arises from the what? From the aortic arch. So this is the aortic arch, like that. All right, and we have our heart right over there. Okay, so now this subclavian artery along its course, it is divided into 3 parts by an anatomical relation of a muscle known as the anterior scalene muscle. So this is the muscle here, and this anterior scalene muscle divides the subclavian artery into 3 parts. It divides it into the first part here, the second part, and the third part right there. Okay, so the first part runs from the brachiocephalic artery like that until to this margin here, which is the medial margin of the anterior scalene muscle. So this is the anterior scalene muscle, and then the second part runs on the posterior aspect of the anterior scalene muscle. Okay, on the posterior aspect from the medial margin to the lateral margin of the anterior scalene muscle. Then the third part of the subclavian artery runs from the lateral margin of the anterior scalene muscle to the lateral margin of the what? Of the first rib, this first rib right over there. So talking of the axillary artery, as we have established that it is the continuation of the subclavian artery from the lateral margin of the first rib, and then it moves along its course in the axillary fossa together with the cords of the brachial plexus. So the cords of the brachial plexus, you have the lateral cord like that and the medial cord, so they move side to side with the what? With the axillary artery. Then as it moves, it goes until to its point of termination at the lower margin of the teres major muscle. So this is the teres major muscle. So at the lower margin right there of the teres major muscle, that's where the axillary artery terminates and continues as the brachial artery. So along its course, it is divided into three parts. We have the first part, the second part, and the third part. So it is divided by an anatomical relation, which is known as the pectoralis minor muscle. So this pectoralis minor muscle here is the guy that divides the axillary artery into three parts. So the first part of the axillary artery, okay, let me just remove this ink. So the first part of the axillary artery is running from the lateral margin of the first rib until to the superior border of the pectoralis minor muscle there. So that's where the first part of the axillary artery ends. Then the second part of the axillary artery runs from the superior margin of the pectoralis minor muscle until to the inferior margin of the pectoralis minor muscle there. So it moves posterior. So as you can see, it's moving posteriorly to the pectoralis minor muscle from the superior to the inferior margins. Then the third part is running from the inferior margin of the pectoralis minor muscle until to the lower margin of the teres major muscle. So these are the three divisions. Then now, along its course, it gives off branches. So the first part of the axillary artery gives off one branch, which is the supreme thoracic artery, or other sources will tell you the superior thoracic artery. So this is the part. Then the second part of the axillary artery, which is posterior to the pectoralis minor muscle, it gives off two branches. So it gives off the thoracoacromial artery, which is this part, and this thoracoacromial artery pierces the clavipectoral fascia to give off four branches, which are the acromial branch, the pectoral branch, the clavicular branch, and the deltoid branch. So this is the thoracoacromial artery. Then the second part also gives off another branch, which is the laterothoracic artery, so which is this part here. Then the third part of the axillary artery gives off three branches, which are the subscapular artery, which is this part, and the anterior humeral circumflex artery and the posterior humeral circumflex artery, which anastomose at the surgical neck of the humerus right there. So it moves something like this, like that. So they go round. That's why they're known as circumflex, because they are rounding up the surgical neck of the humerus like that. Okay, so you have the posterior and the anterior humeral circumflex arteries and the subscapular artery. So these are the three branches of the third part of the axillary artery. Okay, so now let's move on and talk about where the brachial artery comes in. So if you are wondering about the teres major muscle, so this is how a teres major muscle looks like, and at the lower border, just right here at the lower margin, this is where the axillary artery is terminating, and then it continues as the brachial artery. Okay, so now let's talk about the brachial artery, the ulnar artery, and the radial artery. So as we have established that the brachial artery is a continuation of the axillary artery at the lower margin of the teres major muscle right there. Then it continues and forms an immediate branch known as the profunda brachii artery or the deep brachial artery, which is this artery here. Okay, which goes along the radial groove, going to supply the posterior aspect of the arm, supplying the posterior muscles of the arm, which are the triceps brachii muscles. Then the profunda brachii artery continues to form the radiocollateral artery, which is this guy, which goes to anastomose with the radial artery. Now our focus is on the brachial artery here, so we've mentioned one of its branches. Then this brachial artery moves on the medial aspect of the arm, on the medial aspect of the biceps brachii muscle. Then it goes and terminates at the apex of the cubital fossa, okay, on the surgical neck of the of the radius, and then it terminates or bifurcates into two arteries, which are the radial artery and the ulnar artery. So as you can see, let me just try to illustrate something. So this is the brachial artery, goes and terminates, dividing into the radial artery, which is this part here. Okay, sorry for that. And the ulnar artery, which is this artery, moving like that. Okay, so along its course, it has given off this profunda brachii artery. Then it will also give off another branch, which is known as the superior ulnar collateral artery, which goes to anastomose with the ulnar artery there. And then it also give off the inferior ulnar collateral artery, which will also go to anastomose with the ulnar artery right there. Okay, so that's about the brachial artery. Then the let me just remove some ink so that we have a clear picture. Okay, so the brachial artery, as we have established that it is terminating as the radial artery and the ulnar artery. So the radial artery will move from the point of bifurcation and then move on the lateral aspect. Okay, it will move on the lateral aspect of the forearm and then goes distal into the arm and then goes to form the deep palmar arch. Okay, so it goes like this. Let me use some ink. So it goes and it goes like that. So this is the radial artery, like that, and then it goes to form an arch. So this is an arch. So this arch here is known as the deep palmar arch. Then the ulnar artery goes from the point of bifurcation on the medial aspect of the forearm, and then it goes to form the superficial palmar arch, like that. Okay, so along their course, the ulnar artery gives off a branch. So what branch does it give off? I'll use black. So this ulnar artery will give off a branch known as the common interosseous artery. So there is a common interosseous artery right there. Then this common interosseous artery will give off two other arteries, which are the posterior interosseous artery and the anterior interosseous artery, which is here. So as you can see, this membrane here, there is a membrane here known as the interosseous membrane. So the common interosseous artery will give off those two arteries, the anterior and posterior interosseous arteries. The anterior interosseous artery will supply the anterior aspect of the forearm, and the posterior will supply the posterior aspect of the forearm. Okay, and these two ulnar and radial arteries will form two two arches in the hand known as the deep palmar arch and the superficial palmar arch. Remember that the deep palmar arch is formed by the radial artery and the superficial palmar arch is formed by the ulnar artery. And then these palmar arches will form anastomosis. Okay, so the deep palmar arch of the radial artery will form a superficial palmar branch. Okay, and the superficial palmar arch of the ulnar artery will form a deep palmar branch. Okay, so that will form those branches will form anastomosis with each other, and then when that happens, what will happen is that these palmar arches will form what? They will form digital arteries. So these digital arteries, you have common digital arteries right here. So these are the common digital arteries like that. Okay, and these common digital arteries will now form digital proper palmar arteries or proper palmar digital arteries, which are here, supplying the fingers, okay, the digits, which are the fingers. So like that. So these are the proper palmar digital arteries, and that is about the brachial, ulnar, and radial arteries. Okay, so now let's talk about some clinical correlations of the blood supply to the upper limb. So the first one is known as Volkmann ischemic contracture. So this occurs due to whenever there is an occlusion in the arteries of the forearm, which can be the ulnar or radial artery. And when there is an occlusion, it will lead to loss of blood supply, which is a term we call ischemia. And during the healing process of ischemia, you find that the tissue on the adjacent area of the forearm might form a lot of connective tissue scar, okay, a lot of connective tissue scar, which will cause a contracture. Okay, so that contracture might cause a dropped risk like that because there's too much contraction of the connective tissue that has been formed during the healing process, and that we call Volkmann ischemic contracture, which is simply a contracture that was caused due to ischemia. Then another clinical correlation is the axillary artery aneurysm. So an aneurysm is simply an abnormal dilatation of an artery 2 times more than its size. Okay, so this is an aneurysm there, the axillary artery. As we established that the axillary artery along its course in the axillary fossa, it moves along with it two other important structures, which are the cords of the brachial plexus. So you expect that whenever you have a dilatation of the axillary artery, it will compress against those two structures right there. So you have the lateral cord and the medial cord. So as it is compressing against these two nerves, you find that the nerve supply to the upper limb might be compromised, and then a patient with an aneurysm of the axillary artery will present with what? Will present with paresthesia and muscle weakness. So the only way to remove this is via surgery, where you remove this and then reconstruct the two remaining parts of the artery. Then another clinical correlation is that of measuring blood pressure, and we know that we put a sphygmomanometer on the arm, and that purpose is just simply to measure the blood pressure via the brachial artery. Then another clinical correlation is just via the brachial artery pulse. So one thing is that the brachial artery moves along its course on the medial aspect, and then it is medial to the biceps tendon. So this is the biceps brachii muscle, and then the tendon of the biceps brachii muscle is lateral to the biceps, or to the brachial artery. So if you press on the medial aspect of your arm, okay, like this, you find that you'll be able to feel the pulsation of the brachial artery. All right, so that's one of the clinical applications of blood supply to the upper limb. Okay, so these are some of the practice questions that I would like you to attempt and see whether you've understood. So the first one is, write about the arterial supply of the upper limb to the upper limb. So this is an essay type question, so meaning you write about all the arteries that we have talked about. Then number 2, outline 4 clinical correlations of the arterial supply to the upper limb and explain any 2. So I've mentioned about 4, so you write them and explain any 2. Then number 3, which this is a multiple choice type of question. Which of the following branches of the axillary artery pierces the clavipectoral fascia? So you have the anterior circumflex humeral artery, the thoracoacromial artery, the clavicular branch, and the pectoral branch. Forget about this G, this was a typo error. Okay, so remember that we said the thoracoacromial artery is the artery that is able to pierce that pierces the clavipectoral fascia and then goes to give off four branches, which are the acromial branch, the pectoral branch, the clavicular branch, and the deltoid branch. So our answer here is B. Okay. Alright, so this is where we end our video about on the arterial supply of the upper limb. Don't forget to like, share, and subscribe, and drop a comment in the comment box so that we may hear your concerns or anything or recommendations. With that being said, we end our video here. Enjoy your day. Shalom, shalom.